Hello, my name is Tommy Abraham,
I'm Sarah McCann.
and we'll be going over the EKG presentation. All right, today we're going to go over what the EKG stands for, what it does, and what it does. We'll be talking about the P wave, the QRS, complex, and T wave. And my partner Sarah, she'll be talking about the leads and placement, and she'll be talking about the normal and abnormal EKG readings. Then I'll talk about how it relates to the real world. So what is an EKG? It stands for electrocardiography. And what's it do? It records the electrical activity of the heart, providing valuable permanent record of its function. This records the electrical impulses that stimulate the heart to contract. And as the electrical activity passes through the heart, it can be detected by the external skin sensors and recorded as an EKG. Here you'll see the different types of leads. The limb leads, it's labeled 1 through 3 in Roman numerals, and it goes AVR, AVL, and AVF. Then here you'll see the chest leads, and it goes from V1 to V6. Here you'll just see the different kind of placements. V1 to V2 are placed over on the kind of the right side of the heart. V3 and V4 are more located on the interventricular septum. V5 and V6 are placed over on the left side of the heart.
Okay, here we have a normal EKG reading. There's different components to this. For example, there's the P wave, which indicates atrial depolarization. This is when the atria and the heart are going to contract. Next, we have the QRS complex. This indicates ventricular depolarization. This is when the ventricles in the heart are going to contract. And then finally, the T wave indicates ventricular repolarization. This is when the whole heart is going to go back to rest. A normal heart rate is usually 60 to 100 beats per minute with a normal sinus rhythm. Here we're going to look at some abnormal EKG readings. For example, there's a condition called sinus tachycardia. This is when you have over 100 beats per minute, which is an abnormal rate, but you have a normal sinus rhythm. As you can see on the picture, there is no rest in between the ending T wave and beginning P wave. It's just one after another. Here we have sinus bradycardia. This is when you have less than 60 beats per minute, but a normal sinus rhythm. And as you can see on the picture, this is where you have an abnormal length of resting between the end of the T wave and beginning P wave. Here we have atrial fibrillation. This is where you have an abnormal rate and an abnormal rhythm. As you can see, the atria and ventricles are basically contracting whenever they want. And finally, we have bigeminy. This has an abnormal rate, but a normal rhythm. As you can see, there is a normal resting space between the T wave and the P wave, but it doesn't have a normal sinus rhythm like regular people should have.
All right, and how does this relate to the real world? I went to different hospitals to shadow, and in these hospitals, when you go to a patient's room, you'll see the patient's screens. And on these screens, it will show the EKG readings. And along with this, it will provide their blood pressure and the oxygen levels. Whenever the EKG reading is flatline, clear that is obvious that the heart is not working to produce oxygen. Also, whenever like the oxygen levels fall below 90 out of 100, that requires a nurse because it's a percentage of how much oxygen the patient is receiving. And you see to the left here in this picture, these are just the different types of blood pressures. It becomes, whenever you become in the high blood pressure or the hypertension, that's when it becomes a little bit more dangerous. Elevated, anywhere from normal to elevated is a little bit normal. However, if you go past that, it becomes more dangerous. And I'll pause this. Then here's our work recited, and I'll pause this to end the presentation.